खुश रहिए आप लोग। आई माई सेल्फ जीवन प्रतिष्ठा राजवंशी, वर्किंग एज एन assistant professor in optometry discipline in the Department of Faculty of Physiotherapy and Diagnostic. I am working in Vidyapeeth Women's University, which is the first state women's university in Rajasthan. Today I will be going to discuss about the leftover topic of amblyopia. In previous lecture you have learned about the amblyopia, its classification, its types and causes. What are the causes of amblyopia? Now you will study about the assessment of amblyopia, how we will assess the deviation or amblyopia, what are the tests to test the amblyopia, and what is the treatment or management of amblyopia. Firstly, we will compare the magnitude at distance versus the near. Okay, now then we will, for this the test, what are the tests? Hirschberg test, cover test, Berkner test, Krimsky test. There are many tests. Okay. Now, what are the strategies in assessment of amblyopia? Firstly, we will see the visual acuity, then the neutral density filter. In visual acuity, degree of amblyopia we should see crowding phenomena, normal Snellen's chart, single letter chart, and in neural density filter we will see the depth of the amblyopia, difference between organic amblyopia and the functional amblyopia. You have understand now what is organic and what is functional. Okay. Now, visual acuity. Amblyopia is preferred better when isolated letters are used instead of full chart. Okay. Crowding effect, because of crowding effect. Okay. Then in infants, Teller acuity charts. In preschools, aged children, HOTV, broken wheel heart cards, Lee symbol, school aged children, Snellen charts, Logmar charts. Then visual acuity, that is simply Snellen chart. Snellen chart for amblyopia is in another way. That is Snellen's for normally the Snellen's is from 660 to 69, but if for amblyopia it is different, means single letter chart, single letter on a single chart. So what are the advantages of single letter acuity and disadvantages? Directly measures acuity, especially in children 3 to 6 years old, and this is the advantage. And what is the disadvantage? That with isolated letters can lead to underestimated amblyopia visual loss. Okay. Solution: crowding bar may help the alleviate this problem. Crowding effect. What is crowding effect? The amblyopic patient can see all the letters are crowded in each over or around each other. Crowding bar or contour interaction bars allow the examiner to test the crowding phenomena which isolate the octotype. Then strabismic amblyopia, you all know in strabismic eye mostly it use other part of the area instead of the fovea area, that is known as the ARC, that you also know very well, which consist rods. Image that form will reduce in contrast, hence it is also reduced in the visual acuity. Then neural density filter in strabismic amblyopia, better visual acuity and neural density filter compared to the normal eye. The use of neural density filter in front of the fixing eye enhance the vision and depth of the performance. And if the patient is unable to see clearly amblyopic patient is unable to see clearly, then neural density filter is given for visual acuity assessment. Then for contrast sensitivity test, detect the functional difference between the strabismic and isometropic amblyopia. Then strabismic amblyopias showed abnormality only in the high spatial frequency range, and an isometropic amblyopia showed in abnormal function both in the low and high spatial frequency range. Then have you understand about the contrast sensitivity test? No, contrast sensitivity test can be done is for special frequency range and for the high and low special frequency range. Okay, now what is contrast sensitivity function? Contrast sensitivity function is normal contrast sensitivity function and the mild to low contrast sensitivity losses. Then more severe refractive error or severe amblyopia, or mild refractive error or mild amblyopia. Then in the eccentric fixation, fixate away from fovea in strabismic amblyopic eye. Visuoscopy detect or assess eccentric fixation, explain decreased vision and lead to a more accurate measurement of the strabismus. Grid center in nasal to navel reflex. Then what is the binocularity of the stereoacuity test? Binocularity amblyopia reduced visual acuity. It also has reduced stereopsis. Stereo smile for infants. Okay. Preschool random dot stereogram and random dot test for preschool children. Then how we will do the diffraction? Commonly can determine anisometropia, cycloplegic refraction, spasm the ciliary muscles to inactive the accommodation by using drug. Uses 1% cyclopentolate hydrochloride, usually more hyperopia or more astigmatic eye for the amblyopic eye. Then external and internal ocular examination of the eye determine either in the visual deprivation amblyopia or afferent pupillary defect, a characteristic of optic nerve disease, but occasionally appear to present with amblyopia. To rule out ocular pathology, these examinations consist of assessment. Now, what are the management or treatment of amblyopia? We will be discussing this now. Goal of treatment: passive therapy or the active therapy. First one, passive is the optical correction, occupational penalization, and occlusion therapy penalization. And active therapy is the cam visual stimulator, pleoptics, intermittent photopic stimulation. Then goal of the treatment. What is the goal of treatment for amblyopia? To restore and improve visual acuity by two strategies. Present clear retinal image to the amblyoptic eye and to make the child use of amblyoptic eye. How the child can use the amblyoptic eye? These are the goal of treatments. Recommended treatment should be based on patient's age, visual acuity, compliance with the previous treatment, and physical and social and psychological states. Now, what is the choice of treatment? The choice of treatment of amblyopia are used alone or in combination to achieve goal of treatment faster, and so that the recovery may also be faster. Then passive therapy. The patient experiences a change in visual stimulation without any conscious efforts. Okay. First one is the proper refractive correction, occlusion therapy, and penalization. Proper refractive correction. What is the purpose of proper refractive correction? To provide sharp image and providing optimal environment for amblyoptic therapy. Now, what is the purpose of doing occlusion therapy? Cover good eye to stimulate amblyoptic eye. If we will cover the good eye, then obviously the patient will see from the amblyoptic eye. Then occlusion can be classified in several ways of patching: adhesive patching, spectacle occlude, or opaque contact lens. Okay. Then adhesive patching, we can give the patchwork which can be patched in our one eye, and second is the contact lens. Opaque contact lens can be given to the patient. Okay, now what are the types of direct occlusion? Direct occlusion can be by the patch the good eye, stimulate amblyoptic eye, indication for the deprivation amblyopia and the anisometropic amblyopia. Now, what is penalization? Penalization means drug penalization. Get off. What is this is the active therapy. In this, there are penalization, drug penalization, optical penalization. Optical penalization means children who do not tolerate patching can then fog the good eye of the spectacle. Okay. Now, active therapy, that is cam visual stimulator, intermittent photopic stimulation, and pleoptics. That cam visual stimulator means that treat amblyopia by increase the visual stimulator for short period of time, and the good eye is occluded and getting of different spatial frequency and rotate in front of the amblyoptic eye. Now, what is the pleoptics? The purpose of pleoptics to disrupt incentric fixation in amblyopia in strabismic amblyopia. Then apparatus based on ophthalmoscope principle is the pleoptics type. Now, the surgery. If amblyopia is due to cataract, then we should do cataract surgery. Corneal opacity, then corneal grafting. Blepharostosis means tarsal trunk, and due to non-clearing vitreous opacity, then vitrectomy. These are the surgical treatments of amblyopia. And in penalization, drug penalization, get off 1% of atropine instilled daily to good eye, so that the amblyoptic eye is forced to see the objects. Okay. Now, has the concentric advantage and does not totally disrupt the monocular vision. That's all for today's topic. Now, your amblyoptic topic is totally completed. Have a read and have a see this lecture, then have the read from A.K. Khurana orthoptics book. If any query, then comment in comment box. Stay at home, stay safe. Good luck, all the best for studies. थैंक यू सो मच एंड नमस्ते बेटा, खुश रहिए आप लोग।